When you treat people as numbers, you take away that bit of humanity, and that takes the meaning out of healthcare. Having a clinic like Affirm Care is monumental because it allows people that are LGBTQ to be seen and heard in a comfortable space and know that they are being treated as people instead of just a number.
JEDI stands for Justice, Equity, Diversity, and Inclusion. This is a space where minoritized individuals can create family and find like-minded people, but it's also a place for advocacy, and that's a big part of what my office is doing, working with our senior leaders and working with our team members and our employee resource groups. So our employee resource group has been really focused on making life better for minoritized individuals. They're formed by people who are either part of a minoritized groups or people who want to be allies in that group. Usually we're approached by people who want to work on a particular area, and we work together to make sure that their goals are aligned with our organizational goals and our JEDI goals.
I reached out to the leadership of LifeBridge Health and asked whether they had any plans to do anything for the LGBTQ plus community. And the response I got was, yes, we've been approached by several members of the community and wanted to start something, but we haven't found the right person. And my response was, well, I can help out. Affirm Care is a primary care clinic, especially focused on the LGBTQ plus community. And the reason why we started this is because there's a big need of sensitive care to be provided for this special population. It's really important to have a space where you can feel safe and truly be who you are.
This is something that I do truly believe in, not only because I work here, but I believe that having that primary care to be that focal point to which everybody can turn to and say, hey, here's what's going on, is vastly important.
Dr. Weiberg and Eric are incredible champions. They have worked so hard to establish this clinic, and they continue to work to make sure that it's a safe space, that we're providing expert care and equitable care for this community.
I have received so much positive feedback from our patients. They are so happy that we are here and that we are here to support them and to keep them healthy.
There's a lot of work to do in the JEDI space, and I think it's important to pace oneself, but to stay on target. And after a couple of years, I'm really happy to see we're really making some good gains and moving in the right direction.
The community has seen so much growth and so much acceptance over the years. It's kind of monumental.
One of the most rewarding things is when I have a team member who raises a concern about a policy, and we're able to come up with a just response and deal with it, and that team member feels heard. That patient who says they're so happy to see someone who looks like them, that means a lot to me. That's a win. That's the stuff that makes me smile.